Hi, my name is Dr. Todd Austin from Austin Family Chiropractic in Verdon, Illinois, and I am the host of the Dr. Todd Show. I'd like to welcome you to this episode. My guest once again is one of my clinical nutrition mentors, actually, Dr. Bryan Reid. I'd like to welcome you to the show, Dr. Reid.
Thanks for having me once again.
Dr. Reid is from Edwardsville, Illinois, and in our offices we see a lot of people that have been told that they have depression, and they are put on SSRIs, which are selective serotonin reuptake inhibitors. So I actually had asked on my Facebook page, the Austin Family Chiropractic Facebook page, if anyone had any questions, because we were going to have an Ask the Expert segment. And I did get a question from a lady named Ginger, so I'm going to read that from my Facebook here. She says, can you have Dr. Reid break down SSRIs as to what they are and what they do and why they're not good for you? I am not medically trained, and I think that this will help others like me to understand what doctors like you and Dr. Todd are up to.
Okay, great. Well, you just mentioned what SSRI stands for, selective serotonin reuptake inhibitor. What it does is it works within the brain. It also works in our intestinal tract. But what it does is it allows the serotonin to exist a little longer in that neuronal gap so that we can get the effect that the serotonin, that neurotransmitter, is delivering. So serotonin is a neurotransmitter that is coined the happy hormone.
Exactly.
It is very relaxing. It helps to counteract the excitatory neurotransmitters and hormones in our body, the kind of hormones that that probably are upregulated a little more than we would like in society today, because life is so hectic. We are under so much stress.
True.
Whether it be the emotional stresses of your finances, to relationships, to the stresses of chemical stress, which could be tied into poor diet, okay, the toxic medications that we are placed on, to just environmental toxins. And then we've got physical stress too, poor sleep, okay, or not enough sleep, traumas, surgeries. All of those have an effect on our body, and it causes activation of the sympathetic nervous system, which is the fight or flight response. Now, normally, under normal circumstances, the fight or flight response is short. It's not supposed to be chronic like it is today. And in order to bring that fight or flight response down, calming neurotransmitters like the serotonin and the GABA come into play. So when somebody is under a lot of stress, they have no reserve with these calming neurotransmitters any longer. So they need a boost. So they go to their doctor and they are prescribed an SSRI to again bring up their moods, bring up lift them of their depression. Also, it can help with digestive issues, because there's more serotonin in your intestinal tract than there is in your brain.
Exactly. A lot more.
A lot more. The gut is coined the second brain. The brain and the gut are so intimately connected with each other. But with serotonin drugs, reuptake inhibitors, the medications do not provide any kind of long-term relief, because it actually will cause a diminishment of your body's natural production of serotonin. So while you get great benefit early on, over time the effects start to wear off. And that usually results in the doctor prescribing higher dosage of the medication, or he'll switch to harder medications that come to play with some of the other neurotransmitters, like the GABA, like the anticonvulsants, or the sleeping medication, like a Rosaram, for instance, that will help with your sleep, because if your serotonin levels go down, your sleep is going to suffer.
Exactly.
Because serotonin makes melatonin, which is our sleep hormone, and it's responsible for the circadian rhythm. So if you're having sleep problems while being on these drugs for a long period of time, that is partially responsible. So these other medications, okay, can continue to deplete you of those other neurotransmitters that we mentioned, and it's really not a long-term solution to overcoming your depression, your fibromyalgia, your irritable bowel symptoms, okay, mood disorders. there's always an underlying cause as to why you're suffering from these things. And I mentioned earlier, stress is the cause. And one of the biggest stressors on our body is poor blood sugar control. That is a large driver for most people. There's inflammatory issues that haven't been addressed. Again, if you're having some gut issues and you're on an SSRI, it'd be a good idea to look closer to what's happening in the gut. And then we have to trace that back to the type of food you're eating.
True.
Okay, because again, your foods are a big driver for inflammatory or autoimmune disorders.
And it kind of seems like all roads lead to diabetes. When we're talking about cholesterol, and we're talking about SSRIs, and it's like they all have to do with we're eating a lot of junk and sad standard American diet.
Right.
And
yeah, we
that
suffer
affects
from
the liver, and it kind of just goes down that road towards
absolutely. We
diabetes.
suffer from lifestyle diseases in this
Yes.
country, and if you don't address your blood sugar issues, then you're simply not going to get well. That's a deal
True.
breaker.
Yeah, exactly.
Along with your sleep as well,
Yeah.
because you can't heal yourself.
And then you had mentioned fibromyalgia. So a statistic I wanted to throw out there is that 100% of people with fibromyalgia have a serotonin deficiency.
Right.
And not everyone with a serotonin deficiency has fibromyalgia, but everyone with fibromyalgia has a serotonin deficiency. And then the other thing which will lead me to my next question, is I had a new patient come in yesterday, and I asked if he's on any meds. Well, I'm just on this one, and he mentioned a SSRI drug, but he said, it's just to increase my serotonin levels. And I said, well, actually, they don't increase your serotonin levels. They just kind of hold them in the gap longer.
Right.
But we know that there are ways to actually increase one's serotonin levels. What I do in my practice, I know you do some of this in your practice too, is specific amino acid therapy, where we would use things like 5-hydroxytryptophan or 5-HTP to actually make quality serotonin. So can you talk about that, Dr. Reid?
Yes. 5-HTP comes from tryptophan, which is one of the 20 or 21 amino acids that we can get from our diet. And yes, 5-HTP makes serotonin, and serotonin makes melatonin, which is so important for our sleep. And that'll help maintain high levels of serotonin within the brain and within the gut. So if you suffer from irritable bowel, you may be suffering from low serotonin levels in the gut. So that may help restore your levels in the gut, which then can eliminate the irritable bowel.
Exactly. So basically, like two birds with one stone.
Exactly.
Yeah,
Yeah, the two are so closely connected. With the mood disorders, the brain dysfunction, and the gut dysfunction.
Okay. And what I have found is, in order to drive that process, we're trying to create serotonin, good quantities of it in the brain and the gut, is that we need to do 5-HTP, we need to have plenty of omega-3 fish oils, and we need to have certain vitamins and minerals, so a good multivitamin is
Good quality
important.
magnesium is very important, and your B vitamins as well.
So, okay. And then I guess the last thing I wanted to ask you is, there are so many people out there that it seems like are on statin drugs, but also on the SSRIs, and so it's not unusual. I mean that chiropractors like us have a 25-year-old new patient who looks like he or she would be in good health, and then you go down their list of meds and they're on it, Zoloft, and SSRI. So, what are your thoughts on that? I mean, it's just other than I know the stress in the diet.
Right. Yeah. I just don't think that people with their medical doctors or what have you are really addressing the core needs of the patient. They're not
Right.
digging deep enough to understanding what is the cause that is driving this person from having mood disorders, or from having fibromyalgia,
Exactly.
or irritable bowel, or anxiety and depression. They need to ask the right questions, run the various tests to get the full picture, so that they can develop a treatment plan for this person that's going to work. Because
exactly.
it's not a long-term solution to be on these SSRIs or these deplete the patient further, and it also has addiction properties to it. These people get on these medications and they have a difficult time getting off, because once they're off, there's nothing left in their tank to sustain them. So once you remove that drug, they've got nothing left, and their life can deteriorate even more.
Yeah. And another analogy I had heard is like giving someone an SSRI is like putting a gasoline additive in the tank.
Right.
And then wondering why the car doesn't run.
Right, 'cause there's no gasoline in the tank.
Exactly. But giving them the 5-HTP along with the fish oils and the vitamins and minerals
Correct.
is actually like filling up the tank with gas, which is what the car needed.
Exactly. And again, looking for that underlying problem as to why they have low serotonin in the first place. Okay, these people didn't always have low serotonin. What was the event that caused them to lose serotonin?
Yeah. So.
Okay, and blood sugar control issues are huge in this country.
Okay.
And that is a big driver for mood disorders.
And the next episode we're gonna do, blood sugar is gonna lead us to diabetes. So, but thank you for joining me on this episode,
Yeah.
Dr. Reid, and some
It's my
terrific
pleasure.
information. And thank you for watching.